The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, and this is a hot topic, brand new technology, a new breakthrough, and it's Cool Sculpting. It's literally freezing the fat off your body. And with us, we have an expert on the topic, one of the busiest centers in America, Dr. Gerrish. Dr. Gerrish, welcome to the program.
Well, thank you, Randy.
Now, I guess this Cool Sculpting, and we're going to get into a little deeper. I have a lot of questions, but it does. It freezes the fat. And explain how it works a little bit here.
Well, what we're doing is, back in the 1970s, there was a study. It actually wasn't a study. It was a case report of what was called popsicle paniculitis. And fancy words for meaning kids who were eating popsicles all the time were losing the fat in their cheeks. Now the study, so interesting, but the study or the case report sat there for a while, and then in the 90s somebody was going through some studies and looking at it and going through old literature, New England Journal of Medicine articles, and said, wow, look at this, and then the thought came, well, this is a big deal. So 2005 was the birth of the company that developed Cool Sculpting. 2008 was when it first went into commercial use, and the results are amazing. And what we're doing is we're taking those fat cells and we're lowering the temperature on those fat cells where the lipids inside the fat cell crystallize. Fat cell then says, this isn't the normal state of affairs. We are not healthy. And the cells all have this self-regulation mechanism in them. So every day we create cancerous cells. Every day this mechanism identifies it, the cell self-destructs and our body takes it away. It instills that natural reaction. And so the fat cells break down.
They die?
Body takes it, gone. Like liposuction. Liposuction, you mechanically take them out. This is
remove them.
Mechanically gone. Suck, you can see it go through the tube, you can see it in the container when you're done. This instills a reaction where your body takes it away. It processes it through the lymphatic system, through your liver, gone. And the cool part about it is that when you check chemistries, liver chemistries, cholesterol, triglycerides, kidney, they don't move because it's such a gradual process. And so we're really just utilizing what your body can innately do. We're accelerating.
And you do liposuction too.
We do the laser liposuction.
And you like this. I mean, you like this Cool Sculpting. It gets results.
It gets results.
Patients are happy.
Patients are happy.
I knew you were coming on the show today, and I've told my plastic surgery friends and dermatologist friends, and they said, I don't know, they've heard about it, and they're very skeptical. And I tell them, he says it works.
Yeah.
And you're excited about it.
Yeah, and they have every right to be skeptical because there's been a lot of companies who have come out with technology that they promised the world and delivered nothing. And so you get burnt once, and then you become more skeptical of the industry. The science behind this is real. We are seeing such great results that we've added an ultrasound machine to ultrasound people and measure the fat layer before and after.
Okay.
So we can prove, you come in, we measure some abdominal fat, and we have 3 centimeters of abdominal fat, and 4 months later we measure it again, you have 2. We can tell you we've removed 1/3 of your fat.
Have you done it on yourself, your staff?
It's interesting. I've done it on myself, and it was last minute. We have, because we do such large volumes, we have a lot of physicians that come in and want to see the treatment. And so we had a couple physicians flew in from Wisconsin, and it was in December, and we had a huge snowstorm that morning. And the patient who was supposed to come in and be our model said, I'm not going out. It's too dangerous. So we had these 2 people who flew in, waiting to see somebody be treated. And so,
so it was you.
Last minute, it was me.
So are you happy with the results?
Yeah. Pants, lost about a size in pants. I had to go out and buy new pants, have some tailored. Belt, I was already on the last notch of the belt, so all the belts were no longer any good. So, but yeah, it definitely worked. And it's an area that, if you treat things like the lower abdomens or love handles in your pant line.
So the whole trunk area, this is great for that.
Core, back, stomachs, love handles, absolutely. If it's in your pant line, when your pants fall off, you don't sit there and say, well, geez, did it work? You know.
Now, let's talk about your center for a moment, because we've had you on the program before.
Yep.
You have a major minimally invasive or non-invasive, like lasers and fractionated lasers and all the technology, Botox fillers. Yep. And so for people that don't know you, tell me a little bit about your practice. I mean, who's the typical patient, or what kind of procedures do you do, I should say?
Yeah,
aside from the Cool Sculpting?
You know, when I started out, you know, there was the day spa that you could get your, you know, your deep cleansing facial, you could get your hydrating facial, and then the next step, if you had to get some reversal of aging done, was cosmetic surgery, and that was it. And what a huge jump! You know, someone would say, "Yeah, I just want to soften a few wrinkles here. I don't want to have a facelift," and so there was that huge void. And so what we've done, and our mission is to fill that void. You know, when we first started, the technology wasn't there to help us effectively do it. Botox was there, but Botox was not FDA approved, so you know that came in 2002. So some people were weary of that. Sunblocks weren't where the technology is today. Retin-A was always, that's been 20, 30 years that's been around, and that was one of our bigger in the armament. The laser hair removal machines didn't work, and so there was some skepticism.
Now they do?
And now they're incredible. I mean, we get phenomenal results. So we designed a center that was geared towards how do we keep people away from the surgeons? How do we get people, if we get them early enough that we treat them on a regular basis, that you know we can put the surgeons out of business. Now, lofty, and I don't know if we could ever do that, but that's the goal. And so our treatments, the fractional resurfacings, the Botoxes, the volume...
You've done about, what, 10,000 Botox procedures?
Yeah, we do a lot of Botox. You know, it's hard to calculate, but
I mean, you know, 1,000 plus, you know, other, you know, laser procedures, 4,000 fractional procedures. I mean,
yeah.
just.
Well, you know, number one, we've been doing this for a long time. You know, I'm working on my 15th year, so we've had lots of experience.
And I know your age, and I told you on our last interview. I mean, you look about 10 years younger than your age, so you're dipping into some of this stuff.
So I'd be a fool not to.
Okay.
So, you know, the big thing with this technology is that we can make big impacts with people. And so that's where our goal is.
Okay, so let's talk a little bit about who's the ideal candidate.
Yeah. So,
I mean, describe the situation.
Yeah, so, you know, this doesn't replace liposuction. I mean, liposuction has its role. And that's for the person who needs larger volumes of fat, multiple areas. Zeltiq is for the bumps and bulges. So somebody who's the athlete who just says, I can't, no matter what I do, get rid of these love handles. And I'm frustrated. You know, listen, I go and I run 3 miles a day. I'm watching what I eat, and it's not going. Or the mom who just says, I've delivered 4 babies, and I got this bulge on my lower stomach, and I can't get it back. I want to get back to my pregnancy body.
So like the belly button area, great area to treat?
Great area, you know, absolutely. And some of these people, you know, they'll say, you know, if I lose weight, I can make it go away, but then my face looks so thin, my arms look so thin, my breasts have shrunk. I don't like the rest of my body just to impact this one small area.
That's a lot less money than liposuction, by the way.
Absolutely.
I mean, it's more than half. I mean, it's more than half off.
Yeah, and that's the neat
Probably
part about it.
70% off.
Yeah, and that's the neat part about it is not only can we keep you in the gym, keep you back into your lifestyle, no incisions, no garments, but it costs you less.
Okay, so describe the procedure. Okay, so the patient goes in, and you say these are big machines.
Yeah, so the patient comes in, and the first thing we want to do is we want to document their weight. We want to measure the areas we're going to treat. We're going to photograph the areas we're going to treat, and we also want to ultrasound it. So we're going to ultrasound that fat thickness. So, you know, if you came in and you said, hey, you know, I got this area that can't go away, and we do the treatment, and the results take time. So you're going to see it about...
Because the fat dies, you explained to me.
The fat dies, but it
and
takes
then the body has to kind of eliminate it.
Absolutely, and that takes time. So around the 2-month mark, you're going to see about 50 to 60% of the response. By 3 months, you'll see 90%.
So the body has to eliminate?
The body slowly eliminates the area. So, you know, sometimes it's so gradual, people need proof. You know, they say, it didn't work. And we go measure, you lost 2 inches. What do you mean it didn't work? You know, so
you could ultrasound and prove the fat is gone?
Well, we can measure and ultrasound. And so, you know, measuring, you know, you can pull the tape a little tighter. You can, so it's not as scientific. You know, I have an engineering background. I want hardcore data. So they come in, we document their starting points. So back to you, if you came into the office, you know, what happens if you lose 10 pounds?
Do you have a backdoor celebrity entrance for me?
Yeah,
if I go? I'm just kidding. Go ahead.
We can keep it under wraps.
All right.
But, you know, what if you lose 10 pounds? of course your measurements are going to change. So we need to have your weight documented,
right, because you start eating better after the procedure.
Well, it definitely does motivate people to take care.
Gives you some leverage.
Here's the thing, you come in, you want to do the treatment, and you got to go to the gym, but you're busy, you don't do it. But now you're going to say, okay, I'm going to have this treatment done to address it. You walk out of the office, you say, I spent money now to look good. I'm not going to ruin it. This is a great starting point for me now to start eating right. Maybe I should get to the gym. It is not uncommon for people to come in on their follow-up, and not only have they lost inches in the area we've treated, but they've lost inches in other areas. Now, the area that we treated is way out of proportion to what the areas that have non-treated, because the Zeltiq in combination with diet and exercise multiplies. We know cold affects fat cells. The technical term is called apoptosis. The cell dies. It self-destructs.
So it creates cell death.
It creates
fat cell death.
Programmed cell death. Cell is damaged. It no longer should live in your body because it can be detrimental. Body takes it away and it's gone.
Interesting. Okay.
So we know the cold works. So now the question is, the applicators have been designed for the stomach or the love handles. Well, what if you alter the design to go on the legs, on the arms? So it's now an engineering feat to get it to be adapted to different areas of the body.
And I'm sure they're working on that if it works.
They'd be crazy not to be.
So how many of these machines do you have at your office? You have one?
We have 2 in one office and we have 1 in another. So we have 3 machines total.
Now, what are the age ranges? I mean, who's going for this? How are they hearing about it?
Yeah, typically the age, it varies. We see the 20-some-odd-year-old who just genetically her body is built a certain way and she doesn't like it, and she may be fit. It's just not working for her. A lot of women post-pregnancy, post-pregnancy just can't get their body back. Those are the people who they're going on vacation, they go by the pool and they're wearing tankinis, or they're wearing, sarongs around. They don't want to show themselves because they're embarrassed of their love handles or their belly. We see a lot of people who just, for medical reasons, can't have surgery.
Okay.
They won't get cleared. There's people who just are against plastic surgery or can't take the time off. They don't want the scars. I mean, you've talked to a lot of physicians. You know as well as I do that liposuction isn't a perfect procedure. Even in the best hands, people can get a little lump or a bump here.
Yeah.
That scares people. People have had friends who.
So this is smooth results. I mean, what you're seeing is very smooth, very even results.
So when you take that applicator and you put that over the bump and bulge and you put it right on the peak, it pulls that in, and so the tissue from the sides get drawn in too. So when we release it, it feathers itself out. So it treats it almost like a Gaussian distribution where it naturally feathers in. So now if we took somebody, so let's say somebody comes in and says, I want to treat my buttocks. Okay. That's not a bump or a bulge, that's a larger contour. If we put it right in the center of the buttocks, they would have a nice feathered indentation.
Be a dent.
Right, so we couldn't do that, and that's why it doesn't work for buttocks. But if we get a bump or a bulge, it works perfectly. You don't get the lumps or bumps. So it's natural, there's no scars. There's back to work right away. It's patients have, the reason we are the business, and again, when we talked earlier, I don't advertise. We don't put ads in the paper saying, hey, we're doing this new treatment, come on in.
Because, these units, these machines, the Cool Sculpting, are throughout the United States. And
Absolutely.
You are either 1, 2, or 3 busiest center anywhere.
Right. And it's because of the word of mouth and how easy it is. Our biggest obstacle when patients who know us, trust us. And so they're not going to question. They know if I believe in it, they're on board. No questions asked. I'd like to introduce them to my wife because she questions almost everything. But our existing patients say, okay.
Because this is an expensive machine.
It is.
To buy for a doctor.
It is, but it works. And so the patients that we meet for the first time will go home. A week later, call, it didn't work. I wasted my money. It was too easy. I sat there, I fell asleep. There's no way, if it didn't hurt, it didn't work. And it's those patients, and just tell them, patience, it will work.
And if people are just tuning in right now, we're talking about this Cool Sculpting that freezes the fat, creates cell death.
Right.
And the body has to eliminate those fat cells. That's why they don't get results in the first week.
It takes time.
And so every week and every month, it gets better.
It gets better. Come around the 6th, 7th week, they call back. When can I treat this other area?
Really?
Yeah. So our number one patient now, new patient, is actually an old patient coming in to treat another area.
Is that right? Okay, well, they wouldn't be doing it again if it didn't work.
Absolutely.
Okay, and what do the critics say about this, by the way? What could they say? They just don't know. They don't believe it?
Yeah, it's hard to comment when you don't know. If you don't have experience.
You said you've been burned by technology because, I mean, you're a major laser center.
Right.
So, with this new technology, because they don't let you try it out, I mean, you've got to buy it.
Scientifically.
Why'd you get involved?
Fundamentally and scientifically, this makes sense. We all want to make people look good. We all want to make things easy for patients. And quite honestly, if I told you, hey, Randy, what's your biggest thing that you don't like about yourself, and I can treat it and it won't hurt and there's no downtime, you'd love it. It'd make me happy that I can do that for you, and it'd make you happy that you got it. So Zeltiq falls into that category almost. And so there should be a lot of skepticism out there. And that's probably one of the reasons why the company has had slow growth, is that they're breaking down barriers. But what's happening is, as patients and the circulation of great results, and they're flooded now with calls. The best job.
So the patient population is now calling them directly.
Absolutely.
Where do I find a doctor?
Where do I find a doctor? The best job in the world right now is to be a sales rep for Zeltiq, because you don't have to go in and call on the doctor. The doctors are calling them. Easiest job in the world.
Wow, it's that good.
So they're
Is there a learning curve for this?
It's easy, but everything has a learning curve. You can from the gate get good results, but the difference between good results and great results is the experience. For instance, if you want to get that fat to pull into the applicator, okay, and it's on your lower stomach, you can't lay flat, because now what happens? Your stomach is tight, and so I can't pull it in. So now if we position you to maximize that roller, lean you forward, then we can get more fat into the applicator. If the fat doesn't get into the applicator, it's not going to work.
FDA approved this?
Absolutely.
And what they approve it for?
Love handles. So love handles are the FDA clearance. Everywhere else is off-label.
So they go in 1 hour on one love handle, 1 hour on the other love handle.
Yep.
So for the person that's just pretty fit, but maybe after pregnancy they just got areas that they'd have to literally starve themselves to hit those areas, this is perfect for.
Absolutely.
What about the competitive athlete? The bodybuilder or whatever.
Well, I mean, if you're the competitive athlete, you could probably argue they probably don't have bumps and bulges. But if there's a bump or a bulge, absolutely.
So the lipo patients of the past that have bumps and bulges, this can smooth it out?
If there's fat, whether it's a bump and bulge from post-liposuction or it's just a person who's never had any treatment, it will even out bumps and bulges. It will soften a bulge that's never been touched by lipo.
Okay, so the patient comes in for one love handle, the next love handle. How many areas can you treat in one day? Could you hit the whole area, the back, the front, everything?
Yeah, we can do. Because this happens so slowly and the breakdown, there is no overwhelming release of lipids into the bloodstream or anything. We've had patients spend 10, 12 hours. I had one patient come in,
12 hours?
12 hours. She goes, I know why this works, doc. And I said, really? And she goes, yeah. She goes, you starved me to death. I've been here for 12 hours. I haven't eaten anything.
That's funny.
But yeah.
So what areas then do you do? That's 12 areas.
Yeah. Well,
give me the areas.
You look at abdomen. So you have the lower abdomen, which can be for below the belly button down, can either be one on each side or it can be two, one on top, depending on how big the area is or how big the bulge is. We can do upper abdomen, one on each side. So there's possibly 6. Love handles. Love handles could either be one on each side or 2, one in the front and one in the back. So there's another 4 potentially, so that's 10. You talk about below the bra. People wear those, wear a bra and they wear a tighter shirt.
So you could go up around the back a little bit.
We can go on the back. We can even do above the bra. So there's 12, there's 14. So, and then if the inner thighs, if they have a pocket in the inner thighs, we can get the inner thighs.
Oh, you can't do the inner thighs. I thought you told me just the trunk.
Yeah, well, here's the issue. If we can pull the skin, so if you try to grab your inner thighs and pull, and you can pull it, pinch an inch and pull, then it will be able to pull it into the applicator.
That seems like everybody almost.
If it's well, no. Think of your legs now.
Okay.
If I tell you to go on your thigh and try to pinch it, can you pinch it and pull it? It's not as easy as a love handle. Yeah. So if it doesn't get in the applicator, we can't chill it. It's not going to work.
So what's the downside to this? I guess not good for the obese patient.
Yeah.
Or is it?
Well, it depends on their expectations. So I guess if you look at it very, very strictly, no, it's not for the obese patient. We want the obese patient to diet, to exercise, get down to a good weight, and then maybe they're either a candidate for Zeltiq or slim lipo, depending on what's left.
Okay.
Zeltiq, on average, when they've measured before and after treatment, gets about a 23% reduction in the fat layer. So if they're happy with that reduction and they want more, we can do it again and get another quarter reduction. Okay.
And at the price of this, because it's, it's a low price. I mean, they could do multiple treatments.
You could probably treat the same area 2 to 3 times and approximate the cost of liposuction if you don't include the time that they'd have to take off work and things like that.
And the discomfort and things like that.
Discomfort, the garments, time out of the gym.
Younger patients? What's the youngest patient so far you've had? And what do you encourage people to do?
The youngest patient, we've gotten some people in their upper 20s. If somebody's unhappy, listen, we could go away. This whole field of cosmetics could go away, and it's not going to affect your longevity of life. You're going to live a long life. This is here to make people happy with something that bothers them. And if that's the case, if it bothers you, come in. If it doesn't bother you, go on vacation somewhere. Enjoy your life. There was a study. It was interesting. I was about 4 or 5 years ago, I was reading the paper, and there was an article on a handful of patients who had Botox and did it cure their depression. And 90% of the patients who had Botox said their depression was better. Well, we know the mechanism of Botox. It doesn't enhance serotonin production. It doesn't cross the blood-brain barrier. What did it do? It made somebody look better, so they felt better about themselves.
Well, if you can't frown, you can't feel sad. I mean, I also read a study that it's hard to be miserable while you're smiling.
Yeah, well, you can be miserable, you just can't express it.
Yeah. Yeah.
So, but the bottom line is they looked better, they felt better, and something, so if something bothers you, come in and we can fix it.
Okay, so Cool Sculpting is the future. You think so? I mean, in a year from today, you think it's going to be hot? Does that worry you that everybody's going to get it?
I think
it's an expensive machine.
I think that's great. Here's where we are. Here is technology that really works. And patients are learning more and more about it. And the more people we treat and the more people that talk about it, the more popular it's going to get. On the other end, you have physicians who are incredibly skeptical, and they're saying, prove it to me, prove it to me. So the longer they take, the busier we get. And so, it's a good thing.
So you consult other doctors that want to get involved in this? I mean, does the manufacturer, because you're one of the busiest centers, I guess, in the world, do they tell them to call you?
Absolutely. So we're known within the company is that we've done a lot of treatments and we have good experience. Here's a doctor that has concerns. What are their concerns? Is it going to work? Well, geez, this is an expensive machine. Am I going to get a return on this? Is it going to be worthwhile, or am I losing? The economy is bad. Do people really want this? And so they say, well, call Dr. Gerrish. He's been there. He's done that. And see where they're at.
Now, without mentioning the name of the manufacturer, and we've talked about it, that there's this laser company that melts away the fat or something.
Right.
And you said that you wouldn't have it in your center.
No.
And that this is not this different technology. That if it doesn't work, you don't want it.
Well,
why? Why? I mean, it seems obvious why.
Right. Well, people come in and they trust you, and they want results. People don't come in and say, I want to spend money and get nothing for it. On the same token, we've spent a lot of time. I've spent a lot of time building a reputation, going to work, doing the right things, working hard, being passionate about what I do. And what follows is a reputation. Patients know. They know where I sit. They know if they're not a candidate for it, I'll tell them to go away. It's not for them. They know if I think they're trying to overdo something.
Because you have some patients that have been coming to you probably for years.
15 years.
15 years?
Absolutely.
Okay, so if you tell them, hey, do this Cool Sculpting.
There's trust.
And it doesn't work.
Right.
They're probably just silently not going to complain to you. They just won't show up
They
ever
won't
again.
show up. Well, what if I told you, hey, Randy, I got this great stock tip. Slam dunk, you got to do it. You do it and you lose all your money.
Yeah.
You're not going to like me. And I'll be lucky. It's the old saying, if you do something right, you're lucky if they tell one person. If you do something wrong, you're lucky if they didn't tell 20. And so it's very important for us to put together things that give results, things that are home runs. I used to do a lot of sclerotherapy. Okay.
That's vein elimination?
Veins.
Okay.
Vein elimination on the legs. Okay. Tedious work, multiple treatments. Sometimes the veins would respond, sometimes they wouldn't. I stopped doing it because the level of satisfaction that the patients were getting, it was frustrating for them. And so it wasn't, I'm going for the home run results. I'm going for, I'm going to treat you. And you're going to go and tell your friends. I don't care if it's your dirty little secret that you don't want anybody to know that you did it. You're going to feel compelled to tell somebody. And that's what Zeltiq is. And that's why it's done so well. And that's why we're busy. You don't get busy if you don't advertise unless it's word of mouth.
So Cool Sculpting, people just tuning in, we're talking about this new technology that treats the abdomen, bra strap area,
right.
Could be thigh area, where it cools the fat to a secret temperature, I think you told me.
Proprietary temperature. They won't even tell me.
But it's not frozen. We know that.
No.
And those fat cells die.
Right.
And then the body eliminates. So they're not coming back. Those fat cells are dead.
They're gone. But now you're not superhero. You will gain weight if you eat more than you can burn. So now,
but it's like lipo too, the same thing. I mean, if you remove those fat cells, you have other fat cells.
No, and then if you need to store energy because you're eating more than you're going, that needs to go somewhere. So it will find a different, it will reside in a different spot. So you want to keep your weight stable. So the results are as permanent as your weight is stable. But yes, we do not create new fat cells. Those fat cells are gone. Your body, as far as storing things in fat cells, doesn't know whether you had lipo or you had Zeltiq. They're gone.
We are out of time. Okay, so final message. Somebody out there, love handles, areas, that just is not responding to diet and exercise.
Yeah, you don't have to live with it. If it bothers you, you want to get back into the bikini, you're sick of seeing little bulges and you're not wearing tight shirts, you're wearing loose shirts, come in, we can talk. And
you'll tell them if they're not a candidate.
Absolutely.
Have you told that to people?
Absolutely.
Really?
Yeah.
Okay, good, good.
So, there's no benefit for me to treat somebody and have them come back angry.
All right. Well, I want to thank you for coming on the show. Good stuff, good stuff. And it works. So they can find out more on the website. You have information there?
Yes.
Any before and afters on your website?
Absolutely.
Okay, good.
Absolutely.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, it'll be on our website at wellnesshour.com. Just put in Cool Sculpting or Dr. Gerrish. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.